It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Dr. Tamara Patzer, and I want you to think about this, that there's always this moment that a lot of people know and almost nobody talks about it. It's that moment when your doctor tells you that surgery is probably the next step. And maybe you need to think about it, you have to manage it, you have to imagine, is that really necessary? So you have that diagnosis, you have the referral, and you're just saying, is that the only way? So today, on this episode of Optimal Health, I am talking with Dr. Jeff Shebovsky, and he is a laser therapy specialist, and he's just opened a ReliefNow Laser Center in Hamlin, Florida.
Actually, it's a disc, joint, and nerve center.
Okay. So
which includes laser, yes.
Okay, so ReliefNow Laser, disc, joint, nerve, and joint.
ReliefNow Disc, Joint, and Nerve Center.
Okay.
Laser is a part of it. We previously had a laser center in our other locations, and this is more expansive now with other services as well.
So here's something interesting about that is you actually have, is it 2 other offices?
Yes.
With ReliefNow centers, and this is a brand new standalone. Is that right?
Okay. Yeah, the previous offices, the current offices, are 2 different locations in Central Florida, and they operate as a regular medical chiropractic office and physical therapy, and alongside they have a ReliefNow Laser Center. And ReliefNow Laser Centers are across the country and internationally. There's somewhere of, I think, 70 locations now, but we are opening the first, as if you would call it, the flagship of the ReliefNow Disc, Joint, and Nerve Center, which goes beyond just laser and brings in other cutting-edge advanced therapeutic technologies.
So let's expand on that a little bit because you are the flagship.
The chosen one.
Why did you decide to, number one, how did you come about choosing to focus on discs, nerves, and joints? And why Hamlin?
Well, disc, nerves, and joints have been part of our practice for better part of 31 years. That's our specialty. We do neck and back pain, shoulder, knee, hip, joint, foot, ankle, tennis elbow, plantar fasciitis, carpal tunnel, shoulder tendonitis. So, and peripheral neuropathy and other entrapment neuropathies. So disc, joint, and nerve encompasses everything that we do. And we do it drug-free and we do it non-surgical. And we brought in laser several years ago. As the laser field developed, we got on board with the class 4, we call it the deep tissue or regenerative medical laser therapy. And the medical laser has been amazing. This is a very high powered laser, and the results were really off the charts with some of these types of conditions that we see. And I kept thinking, besides laser, we had other therapies we were doing, and we were getting good results with those too, such as spinal decompression therapy, a knee decompression therapy, shockwave therapy, and regenerative medicine, PRP, stem cell, A2M, things of that nature, which we can cover later. But I decided I love the ReliefNow methods and the ReliefNow branding, and I thought this would be a great thing to do and take it beyond just a laser center. So we brought in, we came up with the name ReliefNow Disc, Joint, and Nerve, covers everything that we cover. And we can't call it laser center because it's beyond laser. It's laser, shockwave, spinal decompression, knee traction, and regenerative therapies or orthobiologic therapies. I chose Hamlin, just to answer the second part of your question real quick. Hamlin is in the area called Horizon West. It's a super high growth area of the West Orlando area. And it's Hamlin is the town center of that super high growth area. And it's got the right population, young to middle age families, active athletic community, and very cutting edge itself. And I thought the cutting edge nature of what we do fits in perfectly with this.
So you said something really interesting. It's way more than laser because, yes, you're using your class 4 laser systems for regenerative issues and methods, but then you have the other issues, and it sounded to me like you have a lot of the what would be considered the cutting edge methods that you're able to do. So who would be the people who would want to go to Relief Now at this particular center? What would maybe some of their, I call them pains, what would some of their pains be?
Oh, well, it's people with all types of musculoskeletal pain. So first and foremost, back pain, neck pain, herniated disc, degenerative disc, bulging disc, sciatica, pinched nerves. That stuff is very debilitating for people. And honestly, a lot of the treatment out there is not effective. They're getting drugs, they're getting epidural steroid injections, they're being told they need surgery on the back or neck, which is very invasive and has poor outcomes, especially with the back surgeries. And then there's everything else in between, carpal tunnel syndrome, neuropathy. Tennis elbow is very, very chronic. It can linger for months to years. And we have very effective treatments to treat that. Same with plantar fasciitis. It's the same thing as in the foot as in the elbow. It can linger for a long time, becomes very chronic, very debilitating, very painful. We do a lot of knee conditions, knee arthritis, meniscus, jumper's knee, runner's knee. Anybody who's a sports athlete who hurts themselves, we're able to treat. So there's a wide array from every joint. I even mentioned hip joint. We do the hip a lot too. And who would these people, most of them are frustrated. They're frustrated with the medical system. They're tired of being offered drugs. They want a drug-free solution. They want a non-surgical solution. And that is actually our mission is, and our tagline, our motto, if you will, but really our mission is to help patients to ditch the drugs and skip the scalpel. That is what we live by. If we can help someone get rid of drugs and not get surgery, then we've done our job. And, we realize it's within reason. Like some people have to get surgery at some point. It's the people that are told they need surgery that don't really have to get it. We want to get to those people because we want to save them from that.
So that brings to the way I introduced our conversation about that person who the doctor says, well, looks like surgery's next. So what would that look like if they wanted to talk to you about what might work for them? What would that walk me through what they might do to find out that maybe let's look at this before we do surgery?
What they might do, meaning like to come in the office, what would be done?
Yeah, what would your, like, if they said, hey, doc, that I've been told I need surgery on my shoulder,
Right.
for example, and how would that evaluation progress? And then on top of that, if you said, well, it looks like we might be able to help you with, in some way, how long could they expect it to take? I know everybody's always,
Yeah.
how
So
long?
I'll give you a shoulder example. You mentioned shoulder. Some people, maybe they have a rotator cuff tear, very common. It's not a full tear. See, we have to be clear that if it's a full thickness tear and the tendon is detached from the bone, no matter what we do, we're not going to reattach that tendon. That has to be done surgically. But there's a lot of people in between that have partial tears and tendinitis and impingement of the shoulder, and they're being told they need surgery. And we would have them come in, do an evaluation. We review their MRIs. I'm assuming they had an MRI at this point. If not, we would order one. Take an X-ray if we need to, looking for arthritis in the shoulder joint and that type of thing. We do a comprehensive shoulder exam, and then we make our recommendations. Now, in a person like this, one of the top recommendations would be focused shock wave, which we call piezo wave. We have these focused sound waves. It's not shocks, it's pressure pulse sound waves that are pulsed deep into the tendon or the joint, and it puts mechanical sound energy into that tendon or joint or muscle, and it breaks down the scar tissue and stimulates a healing response. It increases circulation in blood, tells the body to bring its own stem cells to heal. And so for a tendon issue like that, focused shockwave is very important. And to give you a little bit more on shockwave, if you've ever heard of kidney stones in the hospital where they use a sound machine, a blaster, they pulverize the stone with sound waves so they don't have to get surgery. They put them in a special apparatus, which is a shockwave machine, and they break apart the stone into little tiny pieces and they pulverize it almost to like sand, and then they pee it out so they don't have to have the surgery. And so this same technology is available in the medical world in clinics like mine that are progressive, that treat these cutting edge treatments. And we use a smaller machine, but we direct it right at the tendon that's hurting. It finds the one, actually. It's diagnostic as it is therapeutic. And it pulses these sound waves in waves, what they call shocks, but they're not really shocks. Pressure pulse sound waves. And it loosens up the tissue. It makes it more flexible, and it promotes a natural healing response. The body can heal itself if we just give it what it needs. And that's the whole premise. We will combine that with laser therapy, because class 4 laser or medical laser therapy is a very powerful laser, has enough wattage and long wavelength to penetrate into the tissue. So if you combine laser, which increases tissue repair and healing, lowers pain, lowers inflammation, and brings in more fresh blood and circulation, and you combine that with shockwave, it's a magical 1-2 punch for a lot of people. Then we can throw in, if we need to, PRP, which is part of the regenerative medicine part of we do. You take some blood from the person's vein, like a blood test, spin it in a centrifuge, concentrate the platelets, re-inject the concentrated platelets into the injured part. That promotes the body's healing response. So all of what we're doing is regenerative. The laser is regenerative, the shockwave is regenerative, and the regenerative biologics that we're using are regenerative. So that's a perfect example of what we would do in the office. We combine the best of what we have to help the patient get better.
So this standalone office, which in Hamlin, you're able to literally, you have, of course, all the cutting edge information, like you're talking about the PRP, the shockwave therapy, the laser therapy, and you talked about disc decompression and even knee decompression.
Decompression, yeah.
Can you talk a little bit more about the decompression for the knee and for the back?
Yeah, I'll start with the back because that's the biggie. Backs and knees are very common to have pain. Backs, the disc, if a disc fails to have its normal pumping action, the disc has a pumping mechanism that brings in, every time I thought I had a model here, I don't, but every time we walk, the disc pumps fluids from the bones into itself. It's a natural type of mechanism that's there called the disc pumping mechanism. They actually call it the pump mechanism of disc nutrition because it brings in nutrients and fluids and oxygen and water through the vertebrae, because discs do not have a direct blood supply. So when discs start to get injured or they don't work right, they lose their pumping action and then it gets weak. It's sort of like a sponge drying out like I'm here in Florida, right, in Orlando area. It's like a sponge. If you put it out in the heat for a little while and it gets dried out and it breaks apart, right? If the disc is not getting its nutrients and water, it starts to get frayed around the edges. It starts to get weak. It dehydrates. It loses height, and then it buckles around the edge. It bulges, and then it can herniate, where the jelly in the middle, like a jelly donut, pushes out. When that hits the nerve, man, it is really, really painful. It's debilitating. In fact, it's the number one debilitating condition in the world is having back and disc issues. So the DRX 9000 is a type of decompression table, one of the best, in my opinion, the best one in the profession. It's backed by the most research. It has a special motor that adjusts itself many times a second to adapt to a smooth pull. And it creates a negative pressure inside the disc. A negative pressure is a vacuum suctions. And since you have jelly material inside the disc pushing out, you can literally, over about 4 to 6 week period, gently suck in the material back into the disc, and the body heals itself. And that is spinal decompression. It keeps so many people away from back and neck surgery. I can't even tell you how many times we've done that in the last 25 years that I've been doing this, the decompression. You mentioned knee decompression. So knee decompression, you sit on a little chair. We Velcro just above the knee and below the knee, and it has a slight pull to it, and it'll traction the knee out. just a little bit, hold it for like decompression does for like 30 seconds or a minute, and then relax to a certain tension, then it'll pull. And as it does that, it helps the knee to open up, bring pressure off the knee. When most people have knee problems, they're having a lot of pressure. So if we put them that way and we stretch it, it feels good. It also allows fluid and nutrients to flow back into the joint that way. Knee decompression alone is typically not enough. It's often combined with laser and shockwave as a combination, as a trio, if you will. Very, very effective. And then again, if necessary for the knee, we bring in the regenerative medicine products as well, depending on how much arthritis there is.
So for most people, how long do these treatments last? Is it real fast, or is it something realistically that will take a little bit of time? What could somebody expect
Sure.
for pain relief, and then to actual your body rehabilitating?
So it depends on which modality you're using. We'll start with shockwave, or we call piezo wave focus shockwave. Shockwave is once a week for typically 6 weeks, and what the reason it's only once a week compared to a lot of therapies that are maybe 2 or 3 times a week is you're breaking down with mechanical sound waves. You're breaking down tissue and like a micro trauma, and then you let the body, it's going to tell the body to heal. The body's got to heal for a week. So you don't want to hit it again on Monday and then Wednesday. You want to wait a week. The body heals it up and you do it again. Break it down, heal it up. Break it down, heal it up. Break it down. Every time it heals better every week. Not uncommon. Patients go, first week, I feel a little better. It's not that great. Second week, it's a little better this week. Third and fourth week, they're like, wow, this is amazing. I can't believe the difference. It's the body kicking in, doing what it's supposed to do, is healing. We're stimulating that process. So shockwave once a week for 6 weeks. It's a long-term fix. If the body heals, you're pretty much repaired. Now, if you go out and you're like me and you're almost 6-year-old guy and you throw a baseball a lot because you like the men's baseball league, and it's not softball, it's baseball, and I'm pitching and throwing the ball hard, I tear up my shoulder, so I got to do a little touch up here and there. And but if the normal person just lives life, normal person doesn't want to pitch a baseball at 59 years old. They want to just reach the shelf and get a cup out of the cabinet, right? And they can't do that. They can't sleep. Once we heal this, the body is healed and they're good to go. Laser, we do a 6-visit baseline, meaning we see someone 3 times a week because laser is cumulative. Each time you do it, it adds more laser energy to heal. 3 times a week for 2 weeks, and we check on progress. We're looking for someone to improve in that 2 weeks. It could be 90 or 100% improvement. We see that a lot. It could be 50%, 75, 25%. As long as they're showing improvement, we could continue and add more laser to the plan. Laser can go up to 4 weeks, 6 weeks. But we start at 2 weeks because we want to make sure people are improving. If you're not responding in 2 weeks to laser, you probably won't respond in a few more sessions or weeks. So that's how we judge that one. Laser causes the body to heal quicker. It speeds up tissue repair and healing. That's the bottom line of that. So same thing. If your body kicks in and takes over its own healing capacities like it should, you heal up. Decompression, lumbar, neck, DRX 9000, about 25 minutes or so on the table. And that's for the neck's a little shorter, the low back's a little bit longer protocol, but about 20 to 25 minutes or so. That is done anywhere from 4 to 6 weeks, usually 3 times a week. Sometimes, if someone's really severe, remember, back pain is crippling. We have people that can't even walk in down the hallway unassisted. They're going to be on the table 4 or 5 days a week for the first 2 weeks. That's the protocol for that. And then they'll drop down to 3 times and 2 times a week. The average person who's got chronic pain and it's bothering them and they're miserable, but they're not debilitated, they might be 3 times a week. But the plan is 4 to 6 weeks, usually somewhere around 12 to 20 sessions on the decompression for the body to heal. Again, once the disc comes back in and heals, it's healed. Now, can you throw it out again? Can you bend over wrong? Can you play ball? Can you lift your child the wrong way or lift weights? Yes, it can happen. Even with surgeries, there's something called recurrent disc herniation. And people get a major surgery and then the thing herniates again. So we recommend that they do some maintenance. So when you get decompression and you're all better, you're still going to go out and live life. And you're going to put stress and strain and pressure on your back and your neck, and you're going to live life. So it makes sense to maintain it. Usually around once a month or so is what we recommend to avoid a big flare up. Some people do it, some don't. It's up to them. We recommend it. If you're going to live life on planet Earth where there's gravity and stress on the spine, that's what you have to do. Knee on track or knee decompression, we call it knee on track. That's the name of the machine. That runs about 10 minutes or so. It's not very long to treat, 10 to 15. And I think shockwave I mentioned was once a week, but it's also about 10 to 15 minutes. We do about 2,500 to 3,000 pulses of sound waves at each area. And depending on the frequency of how quick it's doing it'll be about 10 to 15 minutes on one body part. I think I covered all of them except for the regenerative medicine, maybe.
Right. I had a question though about all of that. I'm thinking about it from a, perspective of what if I work? How much time is it going to take me away from my job to go have my treatments done? And then, of course, the big question always is, how am I going to pay for this? And what does that look like? Because I know a lot of people, it's like, gee, that sounds amazing. I want to do that. But, do I have to take off of work? Or if I'm retired, how do I fit it into my schedule? And then how do I pay for this?
Yeah, no problem.
Thing.
Those are good. Those are the two biggest things we come up against is time and money, right? That's always the issue. If we had all the time in the world and all the money, it would be easy to do. So we realize people have lives and they work and they have to live life and pay their bills. So first off is we keep hours usually till about 7 p.m. in our offices. So we're there in the morning and then we're there late. So if people get off of work at 5 o'clock or 6 o'clock, they can still come in as late up till almost 7. So that helps a lot of folks with the time thing. You have to make a time commitment. If people just can't get away, they're not going to, we can't email you the treatments. We have to be there. Realizing that decompression and often combined with laser, we call it laser disc decompression. It's actually a registered trademark or a trademarked term. It's combining the laser with the decompression. It's about a 40-minute treatment, between the two of them. So you're there, I would say about an hour, and you got to be there 3 times a week. So it's definitely a time commitment, but it pays big dividends if you get your health and your life back. We may not save a lot of lives like an emergency doctor, but the quality of life is huge. I mean, if you can't play pickleball and that's what you love to do, and if you can't, we're in here near Disney, we have people that have annual passes they're paying for and they can't go walk around Disney because their sciatica is killing them, right? Or their knee is bad. So that's quality of life, and that's what we give back. And someone has to trade is the time investment to go there. We'll make it convenient. We'll make it available for you. But is the time investment worth it for what I get on the back end? And that comes down to the money too. None of these services I've discussed are covered by health insurance. Unfortunately, health insurance covers drugs, injections, and surgery. That's the big 3 that they cover. And that's the system that we live in. These cutting edge technology therapies, they work great, but they're not covered by insurance. So it's not that we don't take the insurance. Insurance doesn't cover the services. So we have to work with people to understand it's an elective service. It's something that you want to do because you realize it's more natural. It's going to help your body heal. And it's not drugs, injections, and surgery. Remember, our job, ditch the drugs and skip the scalpel. If you're tired of getting given drugs every time you go to a doctor, and you're tired of being given epidural or cortisone injections in your shoulder, and you don't want the surgery, then this is the answer for you. As far as financially, the prices vary based on which therapies you're getting. It's all over the place. We do one therapy, we combine several, but we have 3 payment options typically in our office that works. One is you can prepay. A lot of patients, probably 50% of them, if they have the means, credit card or whatever, they prepay and they get a discount of usually 5 to 10%. So that's significant enough to motivate them to prepay, which is, by the way, fully reimbursable if you don't complete your treatment. You're paying as a convenience. We give you the discount, but if you don't finish it, you get a refund, just so you know. Because some people, I don't want to lose my money if I don't finish. So that's not a problem. Number 2 option is split payment. You pay half now and half in 1 month. That gives you 30 days or a month to gather the money. Sometimes you need to get your next paycheck or 2 to make it work. So we give you 30 days in-house installment, no discount, but no finance charges. We're just doing a courtesy and letting you pay over a month. And then the third one is something called Care Credit. It's a healthcare or other financing. It's an outside finance company. Care Credit is the biggest one for helping patients pay for dental procedures, vets for their pets, it started in the veterinarian profession, dentists, chiropractors, all the medical. They will give you 6, 12, or 18 months, as long as 18 months interest free, which is amazing because you could take a bill that looks big and pay $50 a week and it looks more affordable. And it's interest free. So as long as you make the payments through 18 months, you have no risk. Of course, if you don't pay it off on time, they're going to hit you with the back interest. So you do have to be careful about that, right?
So basically, there are many payment options that help you get the care that you want and need. So money doesn't need to be an obstacle. And just like the time, you've made the hours. Most people realize that, if you work, let's say you work 9 to 5 or something, but if you're, near the area, that gives you that 2-hour window after you would be done, or of course you might find a different time during the day. So I think that relieves a lot of stress off of that, because money is always the big question about that is, well, how am I going to pay for it? But like you said, you gave all of those zero interest options. And then of course you can do the credit card, which can be whatever that is. So do you have different programs or packages, like a healthy spine package or anything like that? Or is it all 100% customized?
It's pretty much all customized. I mean, because we have these different therapies, so we customize in different ways. But we make a package for a patient, like if it's shockwave, laser, and decompression combination, which is a common one. We'll package that up at a certain price, and then we'll give them the 3 payment options and so forth. And they run at different levels, like one thing's 3 times a week, one thing's once a week, and so forth. So we'll get them all scheduled for that. Now, if once they achieve a state of wellness and they're no longer pain free, they can opt to do a maintenance package. We do have an ongoing wellness or ongoing maintenance. So people choose to maintain, much like, look, if you fix your car, right, or you get a new car, you want to change the oil. That's your regular maintenance. If you don't do that, the consequences of not changing oil are not good for that engine. You're going to rotate the tires. You're going to do the regularly scheduled manufactured recommended maintenance. We recommend maintenance for our patients for lots of different procedures. Now, laser and shockwave, there's no real maintenance. There's a touch up once in a while. Like if your shoulder's great, but then you did something a little, it's coming back a little bit, you maybe get one session and you knock it out again. You don't need a whole course of treatment. So we don't really maintain shockwave because, like I said before, the tissue heals and you're doing well for the most part, unless you're abusing it again. Same with laser. With decompression, because spinal issues are so pervasive and so chronic, and many of the conditions we see have progressed to a more permanent change structurally. They've already got degenerative change. They've already lost this. You can't unboil a hard-boiled egg. I can't give you back a brand new disc. So you're going to have to take care of it on your own with being in shape and doing exercise at home. And you're going to have to do some maintenance. So for that, we have maintenance packages. And then, that's really it. That's all I was going to say.
Well, that makes a lot of sense.
Right.
I wanted to ask you, is there a patient in mind that you could tell us about that maybe they came in because they were facing some type of surgery, and what did that look like? And then what did you do to help them? And were they able to avoid that surgery, or maybe they were able to go back to playing golf or pickleball or tennis, whatever it was in their life?
There's so many. I can go on and on. I have stories. We have reviews online. I'll tell you 2 come to mind quickly. I can't even think of a third one off the top of my head just recently. So one is my neighbor across the street. He has an Achilles tendonitis for years. He's a runner. He's in his 60s now, still loves to run. He's got a big scar tissue bump on his Achilles, and he just can't run anymore. It's scarred up, and it's inflexible and painful, because scar tissue is painful when it doesn't flex, doesn't move. It's got poor blood supply. It's got a rich nerve fibers. So he comes in. He's done everything, and he says, and he didn't know he's my neighbor across the street. He doesn't know I do this shockwave therapy. He searches online, finds piezo wave, which is a type of focused shockwave that we use. Very, very, very good. And he then notices that my clinic is listed in my name as someone who performs it. So he texts me. He says, "Oh, I didn't know you even do this." He comes in. He just wrote a review 2 days ago. I asked him if I could share it online, and he's 100% like better. He's back to running. He can't say enough good about it. And we combined it with laser, so it's called laser wave or shockwave and laser together. Guy is thrilled. Another guy had a torn rotator cuff. He had a full thickness tear. I said if it's torn, we can't put it back together. But he had other tendon issues, and he had inflammation and pain and other tendons that were the tendonitis but not torn. He was told he needs surgery, and he probably still may need surgery to attach the tendon, but he's very functional right now. He's lifting weights and everything. And we did shockwave and laser on him, and I mean, he's doing so good. Even though the tendon's still detached, the original tendon, I can't reattach that, but we took down the inflammation, we increased flexibility and blood supply, and he feels wonderful. He's doing everything. Like I said, he's at the gym, I think 4 days a week. And the third one recently is this lady. She had a really bad disc. She was like in a wheelchair because she could not walk. And she's out of the wheelchair and walking and doing great. And that's from spinal decompression therapy. So we love these stories, and there are so many of them. We have 3 offices now, and we're doing the third office now. And it's just, I hope that in Hamlin, I'll be bragging about these results soon as well. It's going to be a lot of fun.
Well, that is really amazing. So I just wanted to ask you, if to someone listening right now who maybe they're in pain or they've tried everything and they're at their wits' end, they want to exactly, ditch the drugs, skip the scalpel. What do you suggest they do?
I think they should call our office and make an appointment with me. I'm going to meet with them personally. But the first thing is, if you want to get out of that cycle of drugs and medical injections and potential surgery, you make an appointment. We'll go over everything with you and find out if we're able to help you. We'll review your studies if you have them. If not, we'll order as needed and get you on the road to healing. The body is an amazing tool, machine, I guess. And it has incredible abilities to heal itself. It just needs a little help sometimes. And that's what we're all about, is helping the body to heal in the most natural ways. And these are the most cutting edge. I mean, you look up shockwave right now and class 4 laser and DRX 9000. These are top of the line machines. And they're not very expensive. It's not like we charge an arm and a leg for it. It's very reasonably priced. These modalities are in every major league locker room: baseball, football, hockey, basketball. They're all Major League Soccer. They're all using these modalities because they work so well. So if someone's thinking about it, I say pick up the phone, call us, go to our website, which is ReliefNowHamlin.com. You can schedule from there. The phone number's on there. You can call, make an appointment. I do a free consultation. In other words, I do not charge for you to sit and tell me what your problem is, and we'll talk about it and make sure you're comfortable with it to start.
Well, that's really awesome. So everyone, ReliefNowHamlin.com. Hey, yeah. Dr. Jeff, thank you so much. I think I learned a lot, and
good.
I'm just thinking about, you said it, this technology, this medical regenerative medicine is being used in high-end sports locker rooms, helping people all over the world. And here you are in Florida offering it to the average ordinary person who wants just to live a more active, better life. So that's really awesome. Yeah, so thank you so much.
Truly incredible stuff. I'm impressed every day. It's amazing. But thank you for having me. I really appreciate this. I mean, how else am I going to get the word out about this? I can't go door to door to everybody and tell them. So I appreciate you giving me the opportunity to spread the word, because my mission is to help people ditch the drugs and skip the scalpel. And if I do that, I'm fulfilling my mission. So thank you.
Thank you, Dr. Jeff. Everyone, this is Dr. Tamara Patzer, and this is Optimal Health.
Thanks.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.